Dr. Tomlinson, I've always been curious, just exactly how does the spine work?
That's a great question. The spine is a fascinating structure. There are 7 vertebrae in your neck, which is called cervical spine. There are 12 in your upper and mid back, called the thoracic spine. And there are 5 in your low back, called lumbar spine. The whole thing comes down to structure and function. The structure is how your vertebrae line up. They should line up like little kids' Legos, one atop another. Okay? There also is a disc, and I'll demonstrate that, lined up like this. There's a disc or cushion between each vertebrae, and so 7 vertebrae in the neck, 12 upper back, 5 low back. Disc in between. From a front view, it's a straight line. May or may not be straight here, but it would be a straight line. From a side view, this is the front, this is the back. There are curves. The neck has a curve called a lordotic curve. The upper back curves the other way, kyphotic. The low back curves like the neck, lordotic. And the hip, sacrum, bottom curve like the upper back, kyphotic. The idea to that is, architecturally, an arch is stronger than a straight line. Okay? And if you think of Roman aqueducts, thousands of years old, still around, and a modern building with a straight line, if the building is 50 years old or 75 years old, it's an old building. So the arch helps support the spine and the weight of the body. Now, that's the structural part. And I'm going to set this down for just a minute. The functional part is the central nervous system, which is the brain, the brainstem, and the spinal cord. And we're going to demonstrate that with this in just a minute here. The brain sets up in here, turns into the brain stem, and it turns into the spinal cord. And the spinal cord runs all the way down like this, protected in the back by your backbone, which is called the spinous process, and in front by the body of the vertebrae. Every level where there's a disc, and you can see on this picture, the disc level, a nerve root goes one to the right, one to the left, branching off of the spinal cord. Now, with that, there's different areas of the body they go to. So the whole idea is your central nervous system, brain, brainstem, spinal cord, controls and coordinates every activity or function in your body, from smiling to shaking hands, to marching in place, to digesting food, to having your heart beat and breathing. So the main thing is, if the vertebrae become misaligned due to trauma, such as an auto accident, or repetitive stress injury, such as a work comp case, the body starts to function improperly. So vertebrae out of place, pinching or pressing on a nerve, over time leads to dysfunction, symptoms, such as pain, numbness, tingling, weakness. And the chiropractor's job is to find the source of misalignment, okay? Find the source of pain or symptoms. And then after finding the source of the problem is correct the underlying cause. And the best way to do that as far as structural misalignment is chiropractic treatment. If you have any further questions, tomlinsonchiro.com or Tomlinson Chiropractic Acupuncture Rehabilitation, 816-584-0444. I'd be glad to answer further questions.